Your sense of balance is very important in order to function in your everyday life. Balance disorders can be caused by certain health conditions, medications, or problems in the inner ear or the brain. We spoke with Dr. Johnny Arruda at Redlands Community Hospital in Redlands, who gives us more information regarding balance.
Balance actually involves three major areas: the inner ear, your sight, and a central position sense, the interaction between the brain and your spinal column, telling you what position you're in exactly. Frequently, viruses can involve both your sinuses and your inner ear and cause an imbalance in the input from one balance system versus the other, and that difference can give you a perception of dizziness or feeling ill, and it can take time for your brain to adapt. So with children, they're rarely dizzy for very long, whereas with an older person, it can go on for weeks or months and be very difficult. You can talk about vertigo and dizziness. Dizziness is a more non-specific term. It could refer to simple lightheadedness, just not feeling right, your balance being a little off, and that can be due to all kinds of things, medications, side effects, etc. Whereas vertigo, true vertigo, is that actual feeling of spinning. Either you're spinning or the room's spinning, and generally that means there's a problem with the inner ear or the balance system. One thing to look at too is the vision. Make sure that the person's not developing early cataracts or some other issue with the eyes. Sometimes a neurologist, it's worthwhile having a neurologist look at the person. When there's that imbalance between the balance systems on each side, it's sending an electrical message to your brainstem and your brain, and your brain will probably reinterpret those signals, and you'll have a new set point or that's normal for you, and it takes time for the brain relearns. With work and therapy, just being a little more active, going for a walk every day can help tremendously. But virtually everyone can improve regardless of age.
We wondered what a patient can expect in physical therapy.
Physical therapy, a specialized therapy called vestibular rehab, can dramatically speed the process and help the adaptation, because the tendency is for the patient to avoid the things that make them feel sick, and so they'll tend to sit real still or not move very fast. The therapy will force you through that and help you adapt much quicker. They spend quite a bit of time with the patient doing a real good assessment. Also, they counsel the patients with safety, like not having your house pitch black at night, holding on when you go up and down stairs. So there's some safety aspects. They do an assessment of how bad the balance is, and then they work with specialized exercises. If it's a matter of more the spinning type thing, they'll do eye and head exercises to help your compensation. Unfortunately, it's not something every therapist receives training in, or it's very cursory. They require extra training, so not just any therapist would be able to do it.
And who is at risk for a balance problem?
Pretty much can happen to anyone. It's just that when you're younger, you can compensate much faster. So something that in a young person would only last maybe a few days or a week or so, and then it's just gone, versus someone older than 50, it becomes a major process to adapt. And then it's important to have the assessment to make sure there's not something more serious going on. It's unusual for tumors to cause dizziness, but it's something you want to make sure they don't have. The hearing test can help sort that out. There's specialized balance tests that we do. And frequently it helps to see both the ear, nose, throat doctor and the neurologist, depending on the situation.